Good evening. Good evening, everyone. Once again, I'm here, Dr. Alok Arora, clinical psychologist and expert on autism, here with you all to talk about the secrets. Today, I'm going to reveal some secrets which every parent should know about autism intervention. These secrets I could not find in any book, but these all are experience-based secrets. So today's session is more going to be on discussion or on experience rather than just some theory of about it. So once again, I welcome you all and the participants who are new. For them, I just want to give you a brief introduction about the organization that is conducting these trainings. That's called JKP Care Foundation. So JKP Care Foundation is a non-profit organization, and for our social initiative of supporting parents and professionals, every Thursday and Sundays at 8 p.m. India time, we conduct these small, short webinars, 1 hour of webinars, and that follows with question and answer sessions with from the participants. And these are free series of free webinars on different topics about autism. So earlier we were doing the lifespan management of autism, where we did a series of webinars right from the early childhood till the adolescent and adulthood, what all support is required and how we can support. And now today the topic is on, then we last 2 weeks were very, very important theory of mind that we discussed. And today we have discussion on the secrets that parents should know. Most of the time they are not aware about these things and I find them in confused state. Just before this session, I was doing a consultation with a parent and I found this webinar is answer of all the queries they had because they were confused. They didn't know how to support the child. They were considering child as a problem, all of this. So today I'm going to discuss few strategies or few, not the strategies, rather, a few secrets, I would call them as, which every parent should know. Some of you may already know them. Some of you may connect with these, and you may also connect with your own child or the children you are. If you are a therapist or professional, then the children with different needs, you can connect with them during this session. So not taking much time now, let me begin my presentation. Yes, I want to tell you that we are running a group for these webinars, a WhatsApp group for these webinars. And in that group, we share all these PPTs. Many of the times I share other study material also. So if anybody and future webinar details, Zoom links and YouTube live links come in that group. So participants who are new today, who are not part of the group, you can just reply to us on the same WhatsApp or email where you have received today's link. You may just reply there that you want to join the WhatsApp group link, WhatsApp group. So our team will send you the WhatsApp group link, joining link, and you can join. It is free of cost. There is no charges for that, and upcoming webinar details will be given in that group. You may also ask your queries. If you have questions to me, you may also ask in that group. So autism intervention secrets, every parent should know. Your child is unique. What they need is a parent who understands them deeply. I want to begin with this. Most of the time, I see parents failing to understand their child and overburdening the child with their expectations. I compare my child with other children. I want my child, oh, child is 5 years, child should be doing this. Now, child is not doing this. In this process, what happens is I fail to understand my child's strengths. I fail to understand where the child is struggling. Rather, my focus becomes on what child should be doing. And sometimes we get into forcing the child or sometimes overburdening the child with a lot of therapies, excess of therapies, excess of, and at times, many of the times, different types of chemicals, that is medicines and others we start in order to achieve what I am expecting from the child, not that what my child can do. So each child is unique, each human being is unique, and we have our own strengths, our own challenges. You don't have to overburden your child. You don't have to overwhelm them or we overwhelm ourselves with the expectations. Rather, realistic goals. That is important. Realistic goals for the development of the child, which will help him on day-to-day basis in in ADLs, activities of daily living, or in education. Those goals should be taken care. The second major challenge which I see, I just added this line before some time, the second line, because today morning I was consulting a parent, and the parent was feeling guilty that we are not able to do things for our child. We want to be, they both the parents were there and they wanted to be perfect parent. So I just added this line that you don't need to become a perfect parent. You need to become an aware and consistent parent. Just be aware about things, how my child can progress, what are the struggles, how I can support the child, and have consistency. Consistency in your approach across all environments. So here is a list of 25 common secrets or common points which I want to discuss with you all today. I have been telling about them in my various webinars, sometimes one point, sometimes the other point. All the series, if you see, you'll see today's session, you'll see the repetition of what all I have been talking to you. But I wanted to just have a accumulated list, put them in a pointers at one place, and that's why we created this. So there are 25 points which I want to discuss, which I call them as the intervention secrets that every parent should know. The first one is behavior is communication. I have done series of webinar. I think 2 sessions are dedicated to behavioral communication. So if a child is behaving, if you are seeing the behavior, if you're seeing hyperactivity, if you're seeing stubborn behavior, or if you're seeing ignorance behavior, please try to understand the meaning of every behavior a child is doing is communication. Every behavior we do is communication. So we need to try to understand the meaning behind the behavior rather than labeling the behavior. Now here, few terms are written in Hindi. It's like, don't label as jid. Don't label this as stubbornness of the child. समझो क्या कहना चाहता है. I'm translating it in English. Don't look at the stubbornness of the child, but try to understand what child is trying to communicate with you. Remember, behavior is the first language we all learn, and we learn it naturally from our environment. English, Hindi, French, Spanish, Creole is all later on, Urdu, all later on languages that we learn. But behavior is the first language. When a baby is born or at very infancy level, initial days of the baby, initial months of the baby cries. Expression is crying. But the crying expression also has behavior patterns. Frequency of crying is different. When a child, an infant, is crying due to hunger or crying due to sleep. So the child is feeling tired and wants to sleep, or crying due to some stomach pain or uneasiness or gastric issue. Notice a child now, any small child, any at infancy level, 1 days, 2 days, 10 days, 1 month, 2 months child. Till the time child is developing other communication means, you just notice at them. Understand their crying. Just notice their crying, and it is across the globe. Be it Africa, be it Asian subcontinent, or be it Europe or Australia or US or anywhere in the world. You'll see same patterns of crying. This is their behavioral communication. Child will cry on different frequencies. If child is hungry, crying pattern is different. If child is having some gastric issues, crying patterns. So what child is doing by this crying, that is behavior. And by this changing these frequencies, child is communicating with you that I am having stomachache or I am tired, I want to sleep. Different messages child is giving you through different communication. You're walking on the street and you see somebody known to you and you smile, you wave hands and go. That is behavior. You see the same person next time, you look at the person and you turn your face and go. That also has a meaning. So that is behavior. And both the behaviors have meaning. I would request everybody to kindly put on mute. Gaurav, if you can make me host, I'll be able to do that. So,
Yes,
yes,
sir.
you all can ask your questions after the presentation is over. So initial 45 minutes to 50 minutes I'll be taking for this presentation. So every behavior has a meaning. If somebody I'm coming across on the street, somebody known to me and I'm smiling, that has a meaning. I'm turning my face and going away, it also has a meaning. That is communication. Same ways, every child with his behavior is communicating to you. I am not getting into special needs child or autism children or ADHD children. I'm saying every child, irrespective of what you want to diagnose it as, what you want to name it as or label it as, every child, when they show some behavior, definitely there is a hidden communication. A parent who's able to, or a therapist who's able to start understanding that behavior, who's able to understand the meaning behind the behavior, you have been 50% of the race because you have connected with the child communication. So don't label the behaviors, don't label it as hyperactivity, don't label it as stubbornness, don't label it as the child's demands. Label it as meaning. What is the meaning of that behavior? And same behavior can be used at multiple times for different meanings. If I'm crying, not necessarily I'm crying for food only. I may cry for a toy as well. I may cry for some other items that I want, a chocolate also. So same behavior may have multiple meanings in different situations. So I may do one behavior of hitting to say, I don't want to talk to you or I'm not happy with it. But at the same time, I may do hitting behavior to take a toy from. So behavior is communication. Start observing the behavior rather than labeling this behavior. That is the first message I want to give you. I started with behavior being a psychologist. That is my core domain, behavior management. Then the second point is connection before correction. Imagine an environment. Males who are here or the females who are here, all the parents, all the therapists, please put yourself in a situation that you are going to a new office, new workplace, or you are getting married and going in a new relationship with a new family. If the whole day, both the situations, wherever you can assume yourself, people in the office or people at family members, people you live with, your neighbors, relatives, people you live with, your husband, your wife, keeps on making corrections in you. No, you don't do this correctly. You need to do this. You need to do this. Keeps on talking about you, talking about your struggle, talking about the concerns. How would you feel? In an office where everybody is talking about you, and every time you're doing something, they are making corrections. You have made a presentation, beautiful presentation. You go to your boss and you're giving that presentation. Boss says, "Oh, this is good, but you could have done it this way." Your colleagues come, they come and give you the same response. Even a very junior intern is finding mistakes in you. How would you feel? Similarly, at a new family, once you have got into a new wedding, new marriage, your husband or his relatives or your wife and her relatives or the neighbors or the family, it's a new environment, basically. So people in the new environment are whole day trying to teach you something, trying to make corrections in you, trying to correct you. How would you feel? That is what our children are going through every day. You take them for consultations to teachers and to therapists or to doctors, and you sit with them and you talk about them whole time. The first thing I do is keep the child away. At home, somebody is coming, neighbor is coming, friend is coming, relative is coming. We are talking about our child struggle. Husband and wife, they are talking about their struggle. Teachers in the school are talking about this child only struggle. What kind of environment we are giving to this child? And we are trying to correct him. So, pehle relationship, फिर teaching. Translation of English is first relationship, then teaching. So, first to develop the connection with the child, and then start teaching. So, connection before correction. Child learns only when emotionally safe. When child is connected with you, child will be. And that is, there was a survey also, which I was reading the report. Children who could connect with the therapist, they showed beautiful development. Wherever the connection part was missing, development was wrong. So no matter how many, what your strategies you are using, no matter how good you are clinically, but if you are not able to connect with your child, it is difficult to show the improvement. So connection before correction is my second message to all parents here, that you need to connect with your child. You need to understand your child. Support, then only you can do correction. Whole day correction, it's okay. Even if you are trying to teach something to the child and child is learning it little differently, it's fine, it's okay. First learning and then correction. But what we do is mix the correction with learning. So during learning itself, we start correcting. Example, you are trying to teach a child to write. Child is holding a pen for the first time. You have taught him how to hold. Child is holding a pen for the first time, trying to write. But what you do is, no, don't hold pen like this. You don't have to hold like this. You have to hold like this. So child is trying to write with the pen for the first time and you are making corrections. It's okay if child holds pen instead of this, child holds pen like this. For an example, I have a pen here with me right now. Okay, you want child to hold like this, but it's okay if child is holding like this and writing. Initial levels. So connection comes before correction. Let the child write like this, learn the skill, and then do the correction. Then you'll be able to make it more effective. The third message is regulation before instruction. Upset child cannot follow commands. Calm the child and then teach. Child is upset, child is crying for something, and we are giving instruction. If you cry like this, I will not give you chocolate. Mama had told you not to cry. If you are crying this way, I will leave you here and go. All those instructions. Child is upset, child is in emotions. If you connect with the previous sessions which we discussed, where we have our limbic system, that is emotional brain, and our frontal lobe, that is analytical brain. Now, when the emotional brain is at more active stage, when emotions have taken over, your analysis fail. Your analytical brain slows down. So if a child is dysregulated, if a child is emotionally in a sensitive zone at that hour, and you are giving instructions, one instruction after another, third instruction, child gets more irregulated, child gets more upset, more emotions. A child who is upset, whose emotional brain or limbic system is overactive at one moment, he or she cannot follow the commands because the analytical brain is not responding. So we need to calm the child down and then teach. So all instructions you need to save, reserve for a later stage once child is regulated. Maximum of parents, they want child to speak. With due respect to all speech and pathology, speech and language development pathologists or the professionals who are working in speech and language development, it is an important domain, but it is not the only domain that we need to work. Parents feel my child's struggle is just to speech. Once my child will start speaking, all the struggle will be over. And my answer to those parents, usually in a very rude manner, is please come with me to the mental asylums and see the adults or people who are living there with different mental disorders, who have pure, clear speech, but who do not know what they are speaking. Asylums are full of them. Mental asylum, support asylums are full of those people. Where they are speaking, whole day they are speaking. They have clear speech. But speech is only talking, no communication. So they just mean speaking meaningless or not connecting with communication. So build the communication first. Speech development takes time. Let the experts work on the speech and language, but communication you as parent can build with the child. So eye contact, pointing, gesturing, all of these things should come before the words. And they are prerequisites for the speech development also. So you take your child to the speech therapy, and initial stages, the therapist has to work on eye contact, pointing, gesturing, all of sitting tolerance, all of these. If you start working the same things which are easy to achieve at home, then therapist job becomes easy and you can get speech better, faster. So communication is not only talking. Talking is not communication. Communication is exchange of ideas, exchange of my feelings. That is communication. So it should always be two-way communication. So don't rush for just speech, but build the communication first. Next point. If you have questions, please keep typing them in the chat group and or on your YouTube live. People who are connected with YouTube live, you can just drop your questions there, or you may just write it down with you. I'll give you opportunity to speak. People who are on Zoom, they'll be able to unmute and speak and ask questions also. So break big skills into small steps. Proper behavior is two big things. Teach step by step, micro learn. So try to find out where the real struggle is. My child is dependent to eat. My child does not eat on his own. Now, I need to teach eating skill. I make it a big behavior issue, big issue that child is not eating on his own. I need to feed him a whole day. And I start talking about my struggle rather than the child's challenges. Cool down, relax. Your struggle is there. You need to empower yourself. Break the task of eating food into simple steps. Child has to go in the kitchen, open the drawer. I'm just giving you an example. Open the drawer, take out the plate and bowl and spoon, then go on the dining table. Food is served there, so child has to make own plate and then start eating on his own. Sit on the dining table. Sometimes the struggle is not in this learning the skill, but the materials that we are using. Last session also, I think I was talking about child is 3 years old, 4 years old. And we are asking the child to sit on a dining table which is made for adults, not for the child. We are asking child to hold the spoon, which is made for adults, not for the child. Look at the struggle child is facing. Struggle is not in the skill. Struggle is with the materials we are using. Physical settings. Child wants to do things, but your things are not at child's eye level or hand level. So child does not connect with that. So where you are keeping child's plate, how accessible it is child dependent for that for you to you, or child is able to take it on his own or her own. All of this is important. So break the big skills, whatever you want to teach to the child, into small steps. And then do step individually with the child. What child is able to do, where child is finding struggle. Give the training of the struggle areas. Support, correct in the environment, corrections in the environment with physical settings and with materials. And then you see your child will start learning big skills, but need to give simple, small steps to the child. Next is routine. Routine is therapy at home. Many parents come to me and discuss about giving a structured routine, why it is important to the child. And they make timetables for their children. 5 o'clock this, 6 o'clock this, 5:30 this. Children are not robots. They cannot run with the timetable. You cannot run them with clock. And even if you are able to do it, you are failing in it. Many of us, when we were studying in the school days, created timetables. 5 o'clock mathematics. I also did that. 5:30, I'll do 5:30 to 6, half 6:30, 1 hour, I will study physics. Okay. From 6:30 to 7:30, I'll study zoology or the botany or subject wise. I made this timetable many a time in my life, in my school days. Could never succeed. 1 day, 2 days, 3 days, sometimes for over few weeks, 2, 3 weeks. That's it. So the timetables that we make with clocks do not have a long life. What we need to do is structured routine. When we talk to you as therapists, when we tell you that we need to give structured routine to the child, this is sequence of activities so that child knows what comes first, what comes next, and there is predictability that what I am going to do next. Child is motivated. Okay, next. Okay, fine. After studies, I'm going to go to the playground. I'm going to get playtime. There can always be variations also into it. I can talk about routine for entire 1 hour also, but because of the time duration, I'll not discuss in detail about it. But I just want to give you tips here. There can always be variation. You need to add variations into the time structure routine. If you don't add variations, your child again becomes kind of rigid towards one particular schedule. So yes, after study time is play time. That is structure. But what I am going to study, how I am going to study, or what I am going to play, where I am going to play, that needs to be flexible. That is a routine. So routine is therapy at home. If you create such kind of routine, it is kind of therapy. It reduces the anxiety and behavior issues in children. Predictable day is better learning. The child needs to have a predictable day. Next point is consistency is more powerful therapy than therapy hours. I give 3 hours of therapy to my child, but some days I give it, some days I don't give it. Together, I'm completing 90 hours in a month. Some days 3 hours, some days 4 hours, some days 1 hour, and few days I miss out. But 90 hours of therapy I'm giving in a month. Or else, in a consistent manner, daily basis, I'm giving 3 hours and completing 90 hours. Results are better where I have the consistency. Results are even better even if I have 60 hours of consistent hours of therapy rather than 90 hours of irregular hours of therapy. So consistency is more powerful than therapy hours. You need to be consistent. Many of us feel today it's raining heavily. Okay, it's okay if one day I miss the therapy session. Or now we have to go out for a wedding for 10 days. So we are taking the child out. So 10 days holiday from the therapy. It's okay. Yes, we need to go out for the wedding and child should be exposed to the environment. We should take him. But therapy should continue. If therapist, okay, it is not possible for the therapist to take for us to take the child to the therapy center because it's raining heavily. We should know, as parent, we should know what therapies are going on and how I can contribute to same goals, how I can achieve the child. We should know that. And the family members should also follow the same. I just need one second quick break, just 1 second. I'm sorry. So consistency is more powerful than therapy hours. We need to be consistent. Whatever strategies we are using, again, consistent about therapies, consistent about structure, but what strategies we are using, same strategies should be used by all other family members who are interacting with the child. Many of the times, parents complain this. This was a complaint in a session just before this discussion also. In front of therapist, child behavior is different, but with me, child's behavior is different. Or in front of other family members, child's behavior is different, and with the mother, child's behavior is different. The concern is not in the child. Concern is in your response to the behavior. So how you respond, that is important. So the strategies which about behavior, the strategies which one family member or which therapist is using, the same strategies are to be repeated by all family members. Everybody should be aligned, consistent in the approach. The next point is parents are the real therapists. I have been criticized at various platforms about this. But I want to tell you, 1 hour of therapy will not make much difference in the child. With due respect to all therapists, all professionals, it is 25% of therapy, 75% of parent empowerment. That is the approach which works better. Then 75% of therapies and 25% of parent empowerment. And we as parent, what we feel is, I am taking my child to therapies every day for last 3 months, 6 months. Every day for 2 hours, my child is going for therapies, but I don't see much improvement. Because you are taking your child to therapies, your focus is 75% on therapies and 25% is your involvement. You will fail. You will fail. It has to be 75% of parent empowerment, your strategies, your practice, the therapies that child is going through, you are repeating them. Because child may go for therapies for 1 hour, 2 hours, 3 hours a day. Or in a school, if you're giving very intensive therapies like ABA therapy, 6 hours a day. Rest 18 hours, child is with you. And children learn from their environment. So 18 hours, what environment child is getting? The development will be more at par with that 18 hours than this. Yes, these 5 hours, 6 hours, 2 hours of therapies are powerful, but they fail if they are not practiced in the rest 18 hours. So whatever child is learning, that needs to be practiced. So parents are the real therapists because you spend the maximum time with the child. Next is reinforce what you want to see. Praise small efforts, ignore minor unwanted behavior. Our focus is usually on unwanted behaviors. But focus is not on the small efforts that child is making to make you happy, to develop. So we need to reinforce, we need to praise those small efforts that child is making rather than minor behaviors that we want to focus on. So most of the time, many of the behaviors parents come to me with, like sensory behaviors, and they are like, child is doing hand spinning or child is doing spinning. How do I stop this behavior? I say, don't work on these behaviors until and unless they are becoming on this extreme level that they are a hurdle in learning of the child. These are sensory regulatory behaviors child is doing to regulate himself. And as long as if they are, when child is excited, child is doing hand flapping, okay, 3 times a day, 4 times a day for few seconds, it's fine. But focus on the small efforts that child is making, small development, improvement that child is doing. Yes, if the behaviors are, unwanted behaviors are major, then we need to work on. If they are becoming a hurdle in the learning, we need to work. The golden rule of behavior, ABC, understanding the triggers, antecedent, behavior, and consequence. People who are the regular participants, I don't think I need to speak about it. I have done many sessions on ABC with you all. But people who are new, I request you to go to my YouTube channel, which is at the rate Dr. Alok Arora, DRALOKARORA, my full name, without a dot on space or space. And search me on YouTube. You will find ABC lectures already there. Understand this model. This will help you a lot in your parenting. Each behavior is dependent on antecedent or consequence. We don't work on behaviors. As behavior modification technique, ABA therapy, all of this is dependent on ABC. ABC is the golden principle. So behavior, if you want to change a behavior, we need to observe the behavior and observe the patterns, try to understand what is antecedent, change the antecedent, behavior automatically disappears. Or even if after changing the antecedent, behavior is occurring, we need to change the consequence. So we work with antecedent and consequence rather than working on behavior. Behavior automatically changes because behavior is dependent on environment. So what input I'm getting from the environment or what consequence I'm getting after the output, that makes my behavior. We need to change the input from the environment or the consequence. What do I achieve by doing this behavior? That's consequence. So my humble submission to all the parents is that you need to understand this model, ABC. It will help you a lot in day-to-day challenges. Go through my YouTube channel, you will understand. I have explained them in different terminologies in a very simple way for parents. You can understand. The whole session is there on ABC. Reduce overload. Sensory plus instruction. Too many instructions create confusion. Give short, clear, one-step direction to the child. At times, we give multiple instructions and child goes into overload, sensory overload, already there. In the environment, there is noise, there are lights, and there are, other smells also around. A lot of sensory overloads is there. And movement is there. And same time, we are giving instruction. So child is trying to cope up. The brain is trying to cope up with the sensory processing and over that instructions. And too many instructions, confusion starts. So learning environment is an environment where for the children who are hypersensitive to in their sensory system, where we give them less of sensory overload and step-by-step instructions. Children who are sensory seekers, like hyposensitive, for them we give sensory environment, a sensory room, and instructions. Same environment you can create at home also very easily. You just need to understand what are sensory needs, whether my child is hyposensitive or hypersensitive, and then give step-by-step, clear, short instructions. So that will reduce the overload. Progress is slow but possible. Don't compare your child with other children. Other children of the age are there in class 12 or class 10. My child is still in 8th class. Other children are becoming engineer or doctors, and my child is not able to complete 12th. Other children are able to do this, my child is not. Or the other cousins in the family. Usually it starts with the cousins and neighbors. They are progressing, my child is not. Progress may be slow, but progress is happening every day. In every unique individual, every child, every adult is progressing on a daily basis. Yes, it may be slow. Everyone has his own or her own learning curve. With the strategies which we are discussing, you make that progress a little faster with the support we provide. But do not compare. Celebrate the small achievements. Even if my child is not scoring that grade, that, A++ or 99%, 97%, but he's not failing in the exam. So I should celebrate that he's not failing in the exam, he's passing the exam. And then motivate the child. Slow progress, but it is possible. Follow the child's interest. Children or child learns faster through what they like. Use favorite toy activities as teaching tools. So make a list of the strength. Now, if you take a paper, put a cross there, and in that plus sign, left-hand side on topmost block, you put strength of the child. Right-hand side, you put weaknesses or challenges of the child. Below the strength, you put likings, and below the challenges, you put dislikings. You will see that there is a pattern, and you can do it for yourself also, not only for the child. For any individual, you do it. There is a pattern of likings which are linked to strength, and dislikings are always linked with our weaknesses or challenges. If I'm not able to chew properly, I do not like to eat rice because that requires a lot of chewing. So my challenge, my weakness is chewing, but my disliking is rice. So challenge and strength are always connected with our likings and dislikings. So if I want to work with the child on certain areas, challenge areas, I need to take the liking areas, likes that child will enjoy doing things rather than disliking. The child likes a favorite toy, activity, I should use it as a teaching tool. That is called strength-based approach. We need to follow the child's strength, not the challenges. Challenges we need to work on along with the strengths. Eye contact cannot be forced. Look at me. First you look at me, look at here, then I'll give you then I'll give you this item. Look here. Whole day we keep on saying to these children who have eye contact issues. Don't say this. You're overburdening your child. Look at me repeatedly, don't say. Build it naturally through play and engagement. Do the activities where child has to naturally look at that rather than this command, look at me, look at me, look at me. Use verbals more than visuals more than verbal instructions. For children with autism, it's often seen that they are visual learners. Their visual memory is usually very strong. So you need to use pictures, gestures, demonstrations, video stories, or storybooks with the visuals rather than just the words. They respond better. So anything we want to teach to our child, any learning, any new skill, anything that we want to teach to our child, what we need to teach is with the visuals. We show it to them and then they learn from this. One instruction at a time. Multiple commands creates confusion. It's shorter and clear. Please understand what happens. Please understand. Just a moment. Yeah. Please understand what happens when you receive a command. If I ask you to get up from your chair, you receive this command from your auditory system right now. You're listening to me. Auditory system understands. So the message from auditory system travels to different neurons in the brain. And the brain analyzes the language that I'm speaking, the words that I'm speaking, the sound. Is it familiar with some language? Get up. You have that vocabulary in you. You understand the meaning of that vocabulary, then you respond. If I say get up, I don't say get up, or if I say in some other language, the same instruction, which is unknown to you. For an example, I am saying, Vaikadipo. Now, how would you respond? I say get up. You are responding because you are understanding the words, the vocabulary. But if I'm saying Vaikadipo, you don't understand what is Vaikripo, what language it is. So first step is auditory system is working proper. Second is your neurons are able to connect from the memory and we retrieve the information of these words. Now, when they retrieve this information, the processing time, then they process this information, what is being told. After this, these neurons communicate with other neurons in the brain and the whole process happens. This is called brain processing. And then the command is given to different body parts. What I'm supposed to do to get up, I need to move my motors, fine motors and gross motors. So command from the brain goes to my muscles, my motors, and then I am finally able to get up. But whether again, same time, this is one process, but same time, the analysis. Am I supposed to get up? Is it being told to me? Why should I get up? Who's telling this? And then I take a decision whether I will get up or not. So this is brain processing, very complex process. But to understand it simply, there are multiple tasks happening at one instruction. Now you're giving one instruction to the child, get up from the chair. Child is doing this auditory system, the neurons are connecting from the memory and trying to understand the language and then understand what is being told to me. Why should I do it? Why it is being told to me? Should I do it or not? Who is telling me? Brain is doing this and you're giving another command. Get up from the chair and go there. You're giving second command. or come here. So get up from the chair and come here. Bring a glass of water. Multiple commands. Now, children with autism, if the brain processing is slow, they're stuck in the first command and you are giving second command. So overload of their system. You're giving third command. Within one sentence, you're given three commands. Get up from the chair, go to the kitchen, bring a glass of water to me. It may look very simple to you, but for a child with autism, it is the whole mountain of commands. Processing. How many processings I have to do? I need to get up from the chair, go to the kitchen. Where is the kitchen? And then bring the water. So where to get the water from? Where is the glass? Where is water? How to pour water? How to open the fridge? How to close the fridge? Whether I need to keep the bottle back in the fridge? I need to refill the bottle and keep it back or keep it back empty in the fridge. All of this, so many things are there. So when you do this minute analysis, you will understand how we are overburdening our children at home usually. And that is why you are seeing response at home is less. And in therapy center, therapists, what they are doing is one command, one instruction at a time. Child is able to do it. And then you say, in front of therapist, child is doing it, but in front of us, child is not doing it. So as parent, I need to give one instruction at a time, understand. Because multiple commands, this brain processing will create confusions and child will not be able to do or child will not give the desired results. So give processing time to the child. Child needs a few seconds to understand. In autism, often this brain processing is happening, but it is happening on a slower speed than the regular brain. So don't repeat instructions too quickly. Get up from the chair. Don't you listen? I've told you to get up from the chair. And then with each repetition, our intensity also increased. Hey, get up from the chair. Look at the overburden we are giving to the child. Try to imagine that, visualize it. So from today, all the parents, please follow this. Give them processing time. You will see much better response. Come back to me. Give me your feedbacks on this, specifically these two slides. One is 16 number and 17 number. 16 number is one instruction at a time and 17 number is give processing time. I'll be sharing these PPTs in my WhatsApp group, the webinar group. So you will get all these listing in the webinar group. Imitation is the first step to learning. Copying actions leads to communication and play. Encourage do what I do gains. You want me to listen to you, but when will I listen to you? When you listen to me. You want me to copy you. I'm a child with autism. You want me to imitate you. But when will I imitate you? Only when you imitate me. So connection. How you can connect with the child? Very first day, we give a toy to the child and we start teaching how to play with this toy. And child gets bored, is not interested and does not play the way you want. So very first day, give the toy to the child, let the child explore the toy and play the way child is playing. And you also play with the child on the same style, how child is playing with the toy, how child is exploring. You imitate the child. Do it for 2 days, 3 days. And then child feels, okay, you and child are on same page because you are imitating the child. And then slowly you change your style of playing with the toy. You will see child is also automatically changing the style. So imitation does not happen by saying, do what I do kind of games, or you start following the child. Child will automatically start imitating you. Play is the real therapy. So for children with autism, structured play builds attention, bonding, and learning. Not just free play, guided play is important. So you plan what kind of activities I should do, what play I should do with the child, which areas I need to work on. Each child is unique and different, so we need to plan different strategies for each child. And we have at JKP Care Foundation, we have a beautiful project called Aspire, which is an online model for education and therapies for children, where we are empowering parents by giving them home plans. And it's kind of, we are supporting them through their education as well. And play and sorry, therapies as well, but that the whole plan is activity-based plan, play-based plan. So on the basis of activity, on basis of play, we are able to teach them. We are able to do therapies also. So all therapies, all teachings, education is happening in the playway method. So play is the real therapy for children. Reduce screen time strategically. We visited a doctor. Doctor told us, oh, you are giving 6 hours of screen. No, you should not give screen to your child, especially child is with autism. Don't give screen. Then from the day one, we come back from the doctor's place and we remove all the screens. Children with autism, they learn from the screen. They are visual learners. And suddenly, and they have been using the screen for last 2 years, 3 years, and suddenly you stop the screen. Imagine what they go through. A lot of stress. And that stress may lead into depression, which leads pediatric depression, which leads to regression in autism. So if you want to reduce the screen time, do it strategically. Screen time is also important. It contributes to learning, depends upon what they are watching and how parents are being involved in the screen time. Just giving them TV, just giving them mobile phones to watch, it harms. But if you are giving them TV, structured learning on TV, and you sit with them, communicate with them about what's happening on TV, it is a learning methodology. So we are using screen time positively. Child is happy because child loves screen time. And with screen time, we are teaching many children. So how you are using it, that is important. And you want to replace screen time, you need to replace strategically, step by step, and replace with interactive activities. Teach functional skills, not just the academics. Most of the time, our focus is on the academics, and major focus is on academics. Because we want our children to grow, we want our children to get into that rat race of education and then score good numbers, good marks, and later on get admissions in big colleges or big engineering, medical, or big streams and make career, successful career. But please understand, success does not depend on your marks or the grades. Success depends on how impactful and effective your learning is. Even with less marks and less grades, people are there who are successful in it. So learning is important, not the grades. So teach the functional skills, not just the academics. Their day-to-day skills are very important. Eating, dressing, toileting, vocational, pre-vocational. To a child of 5 years, we are teaching pre-vocational skills. People talk about vocational and pre-vocational at the age of 18, 20. But we start it very early. So independence should be the goal, not just the academics. Academics are important, but should go hand in hand. Avoid over prompting. Too much of help. Child is struggling to put the buttons. We start dressing them. Why child is not able to dress properly? I say, why child is not able to dress himself or herself? Why? What are the concerns? Give the dress, give the clothes to the child in front of me and see. Child tries to put on, but child is struggling. Child is struggling to reverse the clothes, or child is struggling to put arms in the clothes. So we make customization in the clothes that we put to the child so that the struggle is over and child becomes dependent. And then slowly we teach them. So usually this happens. It is out of our love as parent, we do it. Wherever we feel the child is struggling, we start supporting them, but we make them dependent on us. Too much of support. So we need to give only support in the required areas, do the task analysis, find out where the real struggle is. Struggle is never in the whole activity. Struggle is in some small, minute parts of the activities, nano parts. So look at the whole activity, break it into small tasks, and then see where the child is struggling. Provide support only in that area and gradually reduce the support. Learning and like teaching in a good environment, and then support can be reduced gradually. So over prompting is also harmful. Loving my child is natural, but loving and providing excess support will make them dependent forever. Next is use first and then strategy. First finish work, then play. Helps in transitions and compliance. It's like we need to teach first and then strategy to the children. They should understand. So within our routine, it should. That's why we say the structure routine, because predictability, child should know what is going to happen next. And child should also know that first this is important. First I'm supposed to do this, and then that will happen. That's why the structure is important. Siblings can be great teachers. Yes. If you have other siblings in the house, train siblings to model behavior and play. Supporting, not only empowering, not only parents, but empowering siblings also gives us best of the results. Do not overburden siblings. Sometimes siblings are being ignored. If I have a child with autism, my focus on this child and the other sibling of the child is being ignored. Please try to make it that does not happen, because this ignorance will lead some or other concerns in the personality of the sibling. Later on, once he or she becomes adult, you will understand this. So do not ignore the siblings. You involve them, train them to model the behavior, play with this child, teach this child, and sibling will understand the responsibility, and you see that they can be the great teachers. So natural learning environment will be given to the child. And the last 25th point is your energy affects the child. If you are stressed, child becomes dysregulated. Stress travels. Emotions, the beauty of emotions is that they travel in frequencies. So within the family, emotions travel. Within the office, emotions travel. So if just consider, don't forget about child with autism. I'm giving you a regular example. Consider you both are working and you have some issues at your, you both as in the husband and wife, and husband has some issues with the boss at office, and husband is very upset. When you come home, automatically the stress travels to the wife, or vice versa. In an office, when one person is stressed, the stress travels to others. Now, the intensity of that travel depends upon your connection with the person. Your connection as parent is very strong with your child. So the stress which you are taking or which you are going through, it travels to the child and child becomes dysregulated. So stay calm, patient, and consistent. Invest your energy in empowering yourself rather than the questions. I want to be perfect parent. I want to do best for my child. Why my child is not able to do this? Why other children are able to do this? Why am I being given this child? Why am I, what sins I have done that I have child with autism? Why I have to struggle? All of these you need to wipe off. Or what has gone wrong? I went to that therapist, this therapist, he didn't guide me properly, she didn't guide me properly, this doctor didn't tell me this, and this is what is happening with my child. Now what to do? You have to wipe off everything, whatever is there till yesterday or till today. And from a fresh mind, you need to empower yourself and work with your child. So the problem is not in the child. Child is not the problem. Parents need special understanding and skills. So it's not children with special needs. It's the parents who have special needs, not the children. I never call them special need children. Why? Their needs, their wants are very limited. They don't have special needs. It is just the parents who have special understanding and skills that we need to support them. That's all. End of the presentation today. I'm open for the questions. Thank you very much for listening to me. Let me look at the chat if I have the questions. Recordings. Yes, there's a request that please share the recordings. Recordings are automatically available on my YouTube channel because this this is being live streamed on YouTube also. So recordings are there on the YouTube channel. I'm sharing in the chat box. I'm sharing my YouTube channel link. You all can just go there and see the recordings of previous sessions also, today's session also. You can do that. I request the coordinator, Mr. Gaurav, to support with our WhatsApp link as well to all the participants who are not there in the WhatsApp group so that they can join the WhatsApp. Yes, questions, please. Anyone has? I'm glad to see some of the familiar faces. Sujani ma'am, yes, nice to see you. Nice to see you, Bobby. I'm just taking some names which I'm able to recognize and recall. It is Dorothy, yes, they are the regular Bhagirathi, I can see. Terry, I can see the regular participants. So thank you for joining. And any questions anyone has? Let me just have a look at the YouTube live also if there are some questions. Okay. All right. If there are no questions, then we can, I think, wind up for today. WhatsApp group link has already been shared in the chat box of Zoom. It is there on YouTube also. It is there. Okay, Dorothy has a question. Yeah, please, Dorothy, please go ahead. You can unmute and speak yourself, or you can put the question in the chat box. Yes, Dorothy, I'm not able to hear you. Your voice is not coming to me. Make sure your mic is working. No. Others, anyone can hear, Dorothy? If you can hear, just tell me if it is a problem with my speaker.
No, sir.
No, Dorothy, your voice is not coming to us. Maybe some issues with the speaker you or with the mic you have. You may type the question in the chat box. I will answer it. You may type it in the chat box for today. Okay, till the time Dorothy is typing the question, if there is any question from anyone, I am seeing the response, the feedback. Thank you, Bobby. Thank you, Bhagirathi. Thank you so much, Durga. Okay, thank you. So I hope the session was just a recap of what all I have been telling you in different webinars so far. Tips for parents. The topics are different, but somewhere I just pitch in these. So I think the question, the session was impactful, and you all could connect with, visualize, and connect with the mistakes that we have been doing, and how we can make things better. Okay. If you need further support, you feel free to connect with me, and we all can. Right. Gaurav, any questions? Thank you for your all
No, sir.
advices. Please, okay. Thank you all from Africa. Thank you. Thank you, Africa. I'm coming to Zimbabwe now on 22nd. 20. I'm expected to reach there on 20th of June. So we have one. Dorothy has invited me with her from her organization. So I'll be there. Looking forward to see you all there in Africa. I plan to go to Mauritius also on the way back. Yes. Okay, thank you then. Thank you everyone. If there are no more questions, wish you all the best and looking forward to see you all on Thursday once again on the same time, 8 p.m. India time. Hello.
Thank you, Dr. Alok.
Yeah, thank you. Thank you. Nice to see you. Thank you everyone. Good night.